Good morning, everyone. Today's Thursday, April 20th, 2023, and we're here for a work session. And as always, we're going to start with the Pledge of Allegiance. And Bob, can you please take the lead?
Sure. I pledge allegiance
To the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Bob.
You're welcome.
Okay, we have two announcements today. We just want to remind you that there's going to be a public workshop on the comprehensive plan update this coming Saturday, April 22nd, 2023, from 10 a.m. to 12 a.m., and that's going to be at the Suffolk Theater. We're going to encourage all residents, business owners, visitors, and anybody who's curious to, any other interested party to please stop in. And this is for you, this meeting, and you'll hopefully it'll be a great dialogue. Again, it's open to everyone, and hopefully we'll see you there. And also, Bob, it's Earth Day. Did you want to make your announcement?
Sure, the litter committee will be meeting Saturday morning at 9 o'clock. We're looking for volunteers, more volunteers. We have probably excess of 100. We're looking to get that to about 250. 9 o'clock Saturday morning, we'll give you bags, pickers, and gloves. Thank you.
Okay, that's it. Anyone have anything else?
Weather looks good Saturday? I haven't seen
I
it.
don't know.
I think so.
Yeah,
I think
in the
it's supposed
In the
beginning
morning
of
it's
the
gonna
day,
be good.
yeah.
Later on, maybe some rain. Okay.
It's always a fun time, actually, walking around the riverfront, cleaning
No,
up
it's
garbage.
a great day, and there's a
And then we
lot of,
compare bags, and some people cheat and
a
throw
lot of
extra
school,
garbage in there.
yeah.
No.
A lot of kids from the school come, and, their parents come, and it's a great day.
And it's growing, right? I think every year.
Yeah.
It's,
It's good, it's real good.
that's great. Thank you. All right, so we only have one item today, and that's with the Riverhead Volunteer Ambulance Corps. Changes to their billing schedule, and Councilman Hubbard, who's the liaison to the Riverhead Ambulance Corps. Did you want to take it and start us off, please?
Sure. Gentlemen, if you would come on up front. We have three fine members here of our Riverhead Town Ambulance Corps. The
Morning,
president,
guys.
district manager, and Joe is a vice president. Okay. Just maybe state your names so everybody at home knows who we are.
Gary Lake, President of Riverhead Ambulance. Pat Gugliotta, District Manager.
Joseph Oliver, Vice President.
What we're here to talk about this morning is something that unfortunately has come to be in need of many ambulances and fire districts, not only on Long Island, but in New York State and nationwide, where funds have depleted over the years for various things, but the cost of doing business is so expensive. You guys are spending, I think, over $10,000 a month just in fuel alone, answering a number of calls. You're up well over 5,000 calls a year right now, I believe. And the cost of providing that care, the excellent care that you guys do, comes with a price tag. And in trying to figure out how to make this work without putting extra burden on the taxpayers, I think we've come up with a way that many other districts are doing, where they're going to bill for the ambulance service, for the actual ambulance transport. They're going to be billing people for that. And before everybody gets in an uproar, understand that everybody's required to have medical insurance. Are there some people who don't? Yes, I'm sure there are. But your medical insurance provides for payment for ambulance rides. Currently, the Riverhead Ambulance Corps has been billing just for motor vehicle accidents in the town of Riverhead. And you've been doing that for how many years now?
5 years, I think.
Yeah, I think it is about 5 years. And it's gone very well, and it has been a decent source of income to help come in and offset the tax burden that the taxpayers pay in order to keep all these programs going. But billing for all ambulance calls now will really be a good shot in the arm for the Corps, because it's going to allow you to purchase the necessary equipment that you need to. I was flabbergasted when you told me how much a stretcher cost a week or so ago. They're like $20,000 a piece just for a new stretcher. The price of latex gloves since COVID has gone through the roof. Everything that you guys deal with, it's very expensive. So this is a way to recoup some of the money to help you guys stay afloat. It's a good way for us to provide the excellent care that we have in Riverhead, and we do, make no mistake about it. Our volunteer ambulance and our volunteer fire department, our police department, our EMS service in Riverhead, to me, is second to none. And I appreciate the work that you all do. I was a member many, many years ago, so I know what you do, although it wasn't nearly, the volume of calls weren't anywhere near what they are now when I was a member of the ambulance corps. So with that, I'd like to turn it over to Pat and Garrett, and maybe you guys can just explain to us a little bit of how this is going to work.
Sure, so as you have already covered, the cost of everything is outrageous. Like you said, the stretchers, equipment, our monitors are coming up in the next year, excuse me, or two, and those are $55,000 each. They used to be, 5 years ago, $30,000 each. So everything is, excuse me, going up drastically in price, and unfortunately, we have to get the money from somewhere. People are paying for insurance premiums already, so the billing that we're looking to do is essentially the same as the MVAs, the car billing for the car insurance and the no-fault. We're looking to bill the insurance companies to cover some of the costs that we're incurring when we're doing ambulance alarms. When it comes to the taxpayers, you and I are briefly talking in the hallway. I think we've worked out something where the tax dollars will be able to cover any additional fees that may come up outside of the insurance funds, but that's something we'll have to go over a little bit deeper. We're not looking to do anything to the taxpayer. We're here to help, both financially now if we can, and also medically. So our business is helping people. We certainly don't want to put anybody into a jam financially. We're not going to do that. So with the help of the town, you guys have been excellent. All of you guys have been excellent in helping us out, and we'll continue to work together. And with the help of you guys, I think we'll be able to move forward, supplement our income without having any burden left on the taxpayer.
How much is a hospital one?
It varies depending on the level of care and the hospital we go to and the amount of resources that it takes and equipment. Each run varies, and I was just showing Councilman Hubbard here the new billing schedule that some of the other agencies are using right now. So Medicare pays what Medicare pays. You can't negotiate with them, that's
Right.
that. But the insurance companies also have a parameter that you can bill. So we're looking to be somewhere in that parameter so we don't have to burden the taxpayers with any of this.
So I have a question. In New York City, there is a provision that if you are an aided case, that you can select any hospital within New York City. Is that, how about here?
So-
What's the standard here? Because I could see a trip going to Stony
Well,
Brook.
we also get, so the
taking a
mileage
long
is also
time.
separate. The mileage is separate, so per loaded mile, meaning when the patient is in the ambulance, we get paid per loaded mile from the insurance companies as well, and that's separate from the actual ambulance
We
alarm.
take all of our patients to the closest appropriate facility.
Right.
That's the way.
So
it's
somebody says, I need to go to Stony Brook.
written. If it's appropriate, then, and if it meets the criteria that we have, we will take them to Stony Brook. So, most major traumas, pediatric, will all go to Stony Brook. But, if you have a stub toe, we're probably not taking you to Stony Brook.
So Tim was saying the price of fuel is going up and it fluctuates. And I know a lot of other businesses put fuel surcharges on, so they maybe set the price at $2.50 a gallon, and anything over, they start to use a fuel surcharge, and anything under, then they take that away, or whatever the number is.
Have you ever seen anyone take it away?
No, but what I'm asking is, would that be absorbed by the insurance companies if you were to do something like that?
So the mileage that we would be getting paid for from the insurance companies incorporates the fuel.
Right.
It incorporates the wear and tear on the vehicle, the service.
So you could do something like that, and it would be absorbed by the
Well,
insurance.
we will be billing per loaded mile. We don't
Okay.
get billed, we don't get paid going to the alarm.
Right.
But we will get paid from the time we pick the patient up to the time we drop the patient off.
But if
based on the
today
mileage.
the price of gas is $3 and tomorrow it's $3.50, couldn't you put a surcharge on anything over $3 or
I don't know
whatever?
about the surcharge for the insurance companies because they pay per mile. It's like the IRS, right? They allow
Okay,
you
so it's
55 cents per
Right.
mile.
Yeah, we have to
30,
follow
oh,
their-
gotcha.
And
Okay.
whatever you can cover with that.
Just
you
trying to
cover,
find some
right.
more money for you guys.
Exactly. So we appreciate that,
So
but
just to, kind of tell you where we're going, a lot of our stuff is staggered a little bit, but not, it's usually staggered over 4 or 5 years. So like in the next 4 or 5 years, we're gonna have about $750,000 worth of cost with remounting all of our ambulances, which is required by the state, 10 years or more, right? And then we have about 300,000 in monitors coming up over the next 2 or 3 years, so.
How many trips have you taken in the last 2 years?
Trips.
Trips to the hospital, taking break?
So
mean,
last
months.
year
over
we did,
10,000. In the last 2 years, last year we did 5,500 ambulance calls.
Calls, but not everybody goes to the hospital, right?
Not everybody.
No, not everybody.
Yeah.
So
I'm
I
saying
would say
the actual trip to the hospital,
We'd have to get
that's
to
where
that
you
number.
start billing, so
Right.
that's what I'm comparing.
Probably
Right.
not terribly less than
No,
what you
it's
actually.
not. We don't do a lot, so what that's called is a RMA, or refused medical attention. We don't do a lot of those, for a number of different reasons. Me personally, when I'm on the ambulance, I don't like to, I'm not a doctor, so I don't wanna check somebody out and release them and then find out later that they had a major problem that I didn't know about, and now
Sure.
they had a major medical event and I left them home. So all of my patients I take to the hospital. I convince them whatever they wanna do, however I can help them. I don't like to leave them anywhere. They called an ambulance for a reason, right? And then maybe they change their mind or they get nervous. But I would say the majority of our ambulance calls are transports.
Now, in this scenario, if an ambulance is called for somebody and they refuse transport, they wouldn't be billed, or their insurance company wouldn't be billed unless you have them in the rig and you're transporting them
Correct.
to the hospital or a healthcare facility, they wouldn't be charged. The headline to this has to read that you will transport any and everybody, whether you have insurance or don't have insurance. And also that headline has to be that if you have insurance, your insurance will pay for the transport. You're not gonna hard collect on anybody. Nobody should worry about, can I afford an ambulance ride?
100%.
And that's
We don't-
exactly what this
Yeah, that's
is.
the
Nobody
big-
has to worry about that whatsoever.
That's the big thing, we don't want anybody to feel that they are, no one should be afraid to call the ambulance. I can tell you, we are not going to come and take anything from you.
Right.
We've been doing this for 5 years now. We have had one complaint the entire time.
And that's just because the person
Yeah.
didn't understand what the process was.
Yeah.
That wasn't, and wasn't an actual complaint, it was more of a question.
We will make our required attempts, as per the law, to collect whatever money is owed.
They're not gonna get reported to the
Nobody
credit
will go into
agency?
collections and nobody will
then
get reports on their credit.
After we make our 3 attempts, as required by our policies, we will compile the list of write-offs, which, as per our policy, will then be submitted to the town for approval. And that's, we will not be knocking on anybody's door, and I think we've proven that we are not,
Right.
going after people in anything, it's
This
just
is
not gonna
never
happen.
gonna affect anybody's credit. This
No.
is not gonna take anybody to court for lack of payment. It's never gonna happen.
I don't think by law, I think they changed it where, even if we were, which we're not, you can't affect someone's credit for medical billing now anyway, because it has to be resolved. So I think that they took that out, that medical billing or collection agencies couldn't put anything on anyone's credit report, that was medical related, because
That
people
makes
stopped,
sense.
right,
Right.
because the people stopped going, and then
Right.
that's a bigger problem, so, but,
Absolutely.
like I said in the beginning, our entire existence is based on helping people. Just because this is a financial doesn't make us any less helpful. We wanna help everybody, however we have to, and, financially, we're certainly not looking to harm anyone.
We have to do a good job of getting the word out, because
Outreach.
I will say, and I'll use Flanders as a good example, when they switched over to it, they didn't do, in my opinion, didn't do a great job getting the word out, and it scared a lot of their residents, and there was a lot of, uproar about, oh my God, I'm not gonna ever call an ambulance again, I can't afford, X hundreds of dollars or
Yeah,
whatever for the ride.
We don't ever want that, we don't want people to think that they have to have money in their pocket to
Absolutely not.
call an ambulance.
Absolutely
You don't
not.
even have to give us your insurance card.
Right.
That's all done after the fact. All that stuff is done after the fact, like I said, and, you will not be hearing much from us about it.
And when this starts to take effect, we're gonna have extra personnel in the office answering phones. So if anybody has any questions about anything, they can always just call us and ask.
When do you anticipate this taking effect?
Well, that's gonna be, we were actually gonna have that conversation with you guys today, because we can start tomorrow. I spoke with our billing company, who's CAG, who's been doing our billing for the last 5 years. They are very good at what they
We
do.
need to do some outreach first.
Yes,
Yeah.
no, 100%.
So, yeah, we can't start tomorrow because.
No, right.
Okay.
But I'm saying, as early as tomorrow, we could start, but we gotta come up with a plan to get it out to the public first, so I would say over the next month or two. I don't wanna delay this much longer.
No,
No, we don't want to
Understood.
delay it, but we can make sure that, I mean, there are ways that we can reach out to the public.
Correct, and I
Through the
have,
press.
we have,
Tim,
I spoke to
through
a
the
lot of
press.
the ambulance companies across Long Island and, come up with the general consensus of the, press release that will kind of explain our position to the public.
You have a
So we-
website, right?
we have a website.
So
We're gonna
make
put it
sure
on there.
that that goes on the front page.
and we can post it on ours also.
And you guys have a copy of it already.
Yeah.
Oh,
So-
can I have a copy?
Actually,
of that?
yes, this can, Devin, if you wanna make copies and put this
Can you
out.
get this to us electronically
I
as
can.
well?
Yeah.
And then you can post it on
And
our
get
feeds.
Tim a
Sure.
copy of it, so we'll put it on our website. What date is on there? It's not dated, okay.
Well, I mean, I think we should plan like maybe, you know, one, open meeting.
Well, I was thinking an open meeting, I think we can go down to the senior center. I know a lot of our calls involve seniors, and we can spread the information down there, and we might be able to contact some of the senior communities. They have monthly meetings or whatever, and maybe just get in to explain to them the situation and how it's gonna work and how it's really not gonna affect them at all.
I'd
And
like it too if it could be bilingual, because a lot of the Hispanic community will be
That's a
involved by
great
this as
idea,
well. Yeah.
great idea.
Also, we have a director of our senior center, and she's very good, and she has contact with all our villages and
Do you,
and
you
community.
guys have an open channel, right? You have like a channel 24 or something?
22.
Channel
Maybe-
22.
Maybe we can do,
You're on it right
This
now.
goes on, this goes on there, and it'll say everyone's call.
Turn around and speak to it.
Say hi,
No, no,
hey.
you know, maybe we could do like a, you know, something that runs, you know, every
Oh,
hour.
yeah,
or
something like that. That,
You know,
you
do
know.
a, like just a,
So we are doing a, open house, for EMS week. So maybe it's a good opportunity to
Sure.
coordinate something with that as well.
When is that, Pat, do you know?
That's May 20, I want to say May 21st. I'll get back to you on the exact dates.
Okay, but it's in May.
And it's towards the end of May, because that's
Okay.
EMS week.
Yeah,
Okay,
the
so
fu-
we'll do, we can coordinate, through my office, we'll put it on the website, and, we'll also put it on our Facebook page. We'll work with Channel 22, and Tim, you can work with the senior center also with him, coordinate that, because they have great
Yep.
resources, they have everybody's phone numbers, and they can set something up. They also have, they usually serve lunch, during the week, and they get a pretty decent crowd. Maybe they can promote that during one of their lunch, because a lot of people like to come in and have lunch. Okay.
Sure.
So,
we can send a
you can
representative down there.
coordinate.
Sure.
We have a great senior center.
I
and
know,
they
you guys allow me
communicate.
to teach EMT classes there.
Yeah, and
And
they
we're
really
doing one
work,
again
and
this
they
year.
have a handle on it, they serve the meals, the state is happy with the operation. The building is great, and,
and with-
she's doing a good job.
Yeah, and with that Calverton community, you know, I've done some things with them, and they're really great, and, you know, they'll put the word out, you guys can go up and talk about this.
And I just wanted to mention something too while we're on the air. You know, with this billing, our whole idea here in the next year is to expand our services to having more of a full-time staffing in the Calverton area where EPCAL is. And, you know, as you guys have been graciously enough to up our budget, we've been staffing Jamesport through the summer months on the weekend. You know, our plan here and our ultimate plan here is to have an ambulance there 24/7. So, you know, Jamesport is growing and getting a lot bigger, and EPCAL is definitely getting bigger, so.
Another marketing ploy might be to get the Mobile Home Association involved and make sure that they get that out, because I'm sure you'll get a lot of calls from there as well.
Yeah, all of them, right?
Yeah.
You know,
Right.
that's it.
I think that organization folded.
Oh, it did, okay.
Yeah, unfortunately, they don't have meetings anymore, but we will get that information out to the mobile home associations also, along with all the senior groups, senior villages also that we have.
I think this is extremely positive, because there's probably people who are afraid to call the ambulance because they think it's gonna cost them money to begin with, right? And now there's a mechanism that, you know, their insurance will cover it, and I think getting that, I see a very big positive side to this.
Well, it's funny you say that, because I actually answered a phone call yesterday. Some woman called and said that she was transported by us 2 weeks ago, and she's going through her personal books, and she wanted to know if she should be expecting a bill from us.
Exactly,
So,
this is,
and I said, no, of course not. You know, our services don't cost you anything. But that was, you know, somebody who was anticipating that when it's not gonna happen, so.
Maybe moved here from another community
Right,
that
exactly.
had already been
Do
charged.
we need to do a resolution on this?
I thought you guys did it last year already, and we were supposed to.
Eric, do we need to
get
do
this
a
moving, but I'm not
resolution on
sure.
this? Yeah, I think you have to speak up, you're on camera, Eric.
I think there's a billing agreement, right? We just have to amend that.
There is, well, the billing agreement was gonna be an addendum to our contract with you guys, so once
Right.
you guys are done with that, right?
Yeah, so we try to wrap that all together.
So it's done contractual, and all we needed is an amendment?
Yeah, so there'd be a resolution authorizing
Needs
the
the
supervisor
amendment.
signing.
Yeah, because they're already billing
Good.
with the contract they have, so this is just adding other calls that you're gonna be billing
This is just
for.
expanding what we already have going.
Good.
Yeah, we would have to, you know, do that and then agree on our structure of pricing again and modify that.
And I gave Tim a new contract to take a look at for another ambulance company in a different township, so you guys can use that as. you know,
Oh, a little louder, I'm sorry.
It's a great template for putting our program together here.
Yeah, so we're also not looking to reinvent the wheel. Everybody else is doing this. We're probably one of the last groups to go to this. So we're learning from what other people have tried and didn't work, and what other people have tried and did work. So we're picking pieces of what is working everywhere else, and we're gonna start with that. So there'll be should be very minimal adjustments once we get up and running. But as always, if adjustments are needed, then we'll continue to make adjustments until we get it perfect.
great.
But we have good
Smart.
templates going forward
Yeah.
of what's already working in other townships.
Well, you guys put a lot of work into this, like I say.
Absolutely. Just a little plug too, I know you guys are always looking for volunteers to sign up for the ambulance, as most EMS is, fire departments
Yes.
included. So, if anybody wants to join Riverhead Ambulance Corps, they can reach out and contact, I think we had a number on here, did we not? Riverhead Volunteer Ambulance Corps at 631-727-2395. Again, 631-727-2395. You call that number. They also have a website of www.riverheadvac.com, riverheadvac.com. So if you reach out to either the website or the phone number, somebody will get back to them.
Absolutely.
Are you also part of the, I know the governor has passed something where if, like for volunteer firemen, right? You have to be a volunteer for 5 years, and then you can then get tax relief, and they're reducing that to 2 years?
Yes.
You guys part of that as well?
We are.
So that's something I think that we need, as a town, need to look into, not only for you, but for the fire department as well, for the volunteers.
Well, the fire district should be getting that same.
They already have
Yeah,
that.
so.
Oh, they have it 2
Fire-
years?
fire
Yeah,
district,
so
I
we're,
believe,
you know,
does.
we're entitled to the tax break here if you're a resident of this town. Actually, a Riverhead volunteer, actually, if you volunteer in Riverhead, there's other townships that will honor that tax break. So if you live in the Brookhaven Township and you volunteer for Riverhead sometime, they will give you that same tax break. You also get a $200 tax break on your taxes. And if you're a member of Riverhead Ambulance, you also get a beach pass or off-road pass to go on the beach.
Right.
As a courtesy of
So what
being
is the
volunteer.
current, when you vested in that, what's the current duration? Is it 5 or is it 2?
So there's a certain, you have to be a member, good standing for 5, and then you get it. And then, I don't know the exact thing, but there is a time frame when you'll get it for life, after you've completed a certain amount of service.
Yeah,
I don't have the exact time.
okay, thank you.
Great.
Well, we thank you,
Thank you,
all
guys.
the ladies and men of Riverhead Volunteer Ambulance Corps, because you're there every time we need you and do a fantastic job, so.
Well, we want to thank you guys, the town board, for supporting us on what we do and working with us as close as you do.
We can.
And-
How's your vehicle doing that you got last year? Have you used it?
The one that
The
just.
Polaris, yes, we've used it quite a few times.
Good.
Beach rescues.
You have used it.
People in the woods with the Moto One track and things like that, so that thing has come in unbelievably handy.
Railroad tracks too, down
The
there.
railroad track, because the old
Yeah.
Polaris, the old
Right.
Gator wasn't tall enough, so it
bottom
hit the
out,
bottom,
yep.
yeah. So,
I remember you were having trouble with one rescue not too long ago, and that's what prompted us to
yes.
find some funds.
Yep, and you guys again stepped up to the plate and you guys helped us
Told
out
you.
with what we needed, so.
Yeah, good.
And they ordered a first responder vehicle last year, and they're still waiting on that.
That was
It's,
supposed to be delivered last July. We
Just
still don't
with
have
the
it.
way the car manufacturers are with the
Now
computer
we have,
chips and everything, it's.
2 ambulances coming up and another first responder, so.
And let's not forget also, and this is important, we have to really start putting our nose to the ground about a new headquarters for the ambulance corps.
Oh, yeah.
But we're hoping that's gonna, this new
This will help offset some of the money that
financial
can be put
income
aside.
will help
During
with that.
COVID, we really found a lot of the weaknesses in our,
Well,
in areas, so.
There's gonna be other issues with the state as well, as far as the vehicles being outside. And I think we're about to find that out. I don't
Because
know
there's
for sure.
medications in them that have to be at
Yes.
a certain temperature, but one thing that sticks out in my mind with COVID came when you go out on a call of a possible COVID patient, and you come back, you don't have a decontamination area suitable to decontaminate your personnel before they have to go back out on another call.
Or go back into the main
Or
building where
or
everybody
go
else
back
is.
into the main building and infect that. So these are all things we have to look at with the new headquarters coming up. But we haven't forgotten it, we just need to get our ducks in a row here, and this is certainly gonna be a big help towards that.
Yes. Excuse me, I agree. Allergies, I apologize, guys, I'm not
That
sick.
time of
I
year.
don't have COVID or nothing, so we're okay.
All right,
Everybody's like
guys.
backing away from me little by little.
Thank you. Be
Oh,
safe.
Anybody
Thank you
have
for
any
your job.
questions?
No, I think it's great.
Okay.
I mean,
Yeah,
Thank
we'll
you
get the
guys
word
very
out.
much.
Yep.
Yeah, we have to get the word out.
If you guys have
Tim,
anything else, obviously, you guys know how to get a hold of us, and I think, again, working together with this and getting this out, is gonna make it a lot, more seamless for the residents of,
Right.
Riverhead.
And if you get a Spanish version of this, it'd be great, because we can put it on the kiosk both in English and Spanish.
Oh, that's right, we have the kiosk downtown.
Yeah, we have it
That's a
right
good,
outside here. And the churches,
we may have to have somebody in-house
Yeah.
convert this to Spanish. I don't know if you guys have a,
I have somebody working today, actually, and I'm gonna ask him when I come back,
All
'cause
you
he
do
does.
is put this into Google and you press translate to Spanish.
Actually, that's
Really?
right, you can actually do
That's
that
it,
too.
that's how I translate. If you want,
I'm gonna send you guys
you wanna
digital
look at
copies
it,
if I can do
because
it.
I can read and write
Before I do that,
Spanish.
I'll send you both copies.
Yeah.
Churches
Okay.
are a good place.
So have
too.
that person put it into Google, it's real easy, just type it right in, press whatever
Translate?
language you
Yep.
want, you could even do it in Polish.
It's so easy now, right?
Yep, and it'll pop up, sometimes it's off, you have to always scope it, but if you want, I'll take a look at it.
Okay,
After you
perfect.
guys finish, okay? We'll
Absolutely.
do that for you.
Awesome.
Thanks, guys.
Thank you
Houses-
very
Thank you.
much.
thank you, gentlemen. Keep up the great
Houses
work.
of worship,
Yeah.
all right? They'll put this out there.
Okay.
All right,
Yeah.
that'll be
Yeah,
great.
we would love to work with them as well.
That'd be
Great.
Yeah. So, thank you very much,
Awesome.
gentlemen.
Thank you, gentlemen.
Thank you very much.
Okay, this is gonna conclude our discussion items. In a moment, I'm gonna ask for a first and a second to go into executive session to discuss two matters on personnel, matters surrounding possible leave of absence for an employee with Hegemiller, matters surrounding possible change in status of an employee, and that would be with Howard Redenti. And can I please have a first and a second to enter into executive session, please?
Motion?
Second.
All in favor?
Aye.
All opposed? So moved. Be safe, everyone, and have a great day.